Hello, good evening. And before we forget, that's the disclaimer, right? So that the images displayed during this medical training session are for education purpose only. All right. So let's start with the larynx. Now, actually, this is such a good topic, and there are so many things to understand in this that will, the way we are learning every time, exactly the same way, we'll keep on building up components one by one, right? So here it is, the larynx, actually so musical, right? It is like a very well orchestrated thing. So it is the larynx, right, which will be, say, air which will be coming out of the trachea or going in of the trachea, right? The larynx is using that. All those muscles of larynx, what they will be doing, they have got one function, that is they open or close airway, right? And today we'll be seeing it in, say, endoscopic image, that when we really hold our breath, what really happens to those vocal cords and how they actually say they are closed. Second thing, for the proper production of speech, right, we need to increase or decrease the tension of those vocal folds. We'll see these vocal folds, how exactly they work, right? But that is what gives the speech. All those variations, right? Variations in the speech, voice, all those things, they are because of this well orchestrated system. So let's start. Yes, good evening. So let's start with front of the neck. Now, interestingly, this is the point from where we'll start, and today we'll end up at this point only, right? So we'll keep on removing muscles, everything one by one, and then we'll reach to the core, we'll understand it, and then once again we'll start adding layers one after the another, and finally we'll end up at this point, right? So this is what this is, front of neck, right? And in this, we have just removed skin and subcutaneous tissues, right? Nothing more. That's what we have removed, right? Very, very famous muscle. So we need not write even full name, right? Sternocleidomastoid. And that's the clavicle. Now our today's prime focus is, as it is, larynx, because larynx is our chief guest, right? So first thing first, we'll try to reach to larynx, and in that process we'll see that what exactly we have to do, right? So say let's remove this sternocleidomastoid and let's remove the clavicle, right? So they have been removed. Now once they are removed, what we see is all these muscles collectively, right? Collectively, they are infrahyoid muscles, correct? They are infrahyoid muscles. Infrahyoid muscles. These are the muscles which we'll be watching at the end, right? At the end, we'll see that all the sternohyoid, everyone, right? We'll see those muscles at the end. Right now, we are very eager to reach to the larynx. So that's why over here what we have done is we just removed all infrahyoid muscles, right? So they have been removed. What we immediately see is over here, and this is the thyroid gland, correct? Thyroid gland, which has got two lobules, right? Right lobule, left lobule, and in between it is connected with what's called as the isthmus, right? Isthmus is the joint. So it is the isthmus. Right? So we remove thyroid gland also. All right. So thyroid gone. Right? Now once the thyroid is removed, right? So like our thyroid gland. Once that is removed, what we now see is our important structures. First thing first, what we watch over here is the hyoid bone, right? Now we know this bone very well. And then there is very famous thyroid cartilage, right? So that's the thyroid cartilage. And in between, it is the membrane, right? In between this one, right? So it is thyroid membrane. And this membrane, which is thin, it is thick at the medial part, and that's why then we'll call it medial thyroid ligament. And then posteriorly also, right, it is thickened, so we call it, say, lateral thyroid ligament. All those things will come, just we talked about it. So this is thyroid and thyroid cartilage, and just underneath it, this is the cricoid cartilage, right? This is what we have already talked about and even seen that, right? Why thyroid? Because it is shield like, right? It is like a shield. And why cricoid? Because it was like a ring, right? You remember that, ring like, right? It was a complete ring. Okay. And then that's the trachea, correct? That's the trachea. And then those are the tracheal rings. It goes down. And yesterday we said that thyroid and cricoid, they both are so important, because what they really make is the framework, right? They make the framework of larynx. So entire larynx and its mechanisms, they will be constructed around these cartilages. No doubt we'll be adding few more cartilages, but these are the prime frameworks. All right. So here it is. Now, say, do you see this? They are carotid sheath, right? They are carotid sheath. Now, when we'll be talking about the blood vessels, yes, at that point we'll cut them, we'll actually explore it, we'll see all the vessels, we'll see their branches. But right now, no, we don't need that. We just know that they'll be having major blood vessels, right? Right now, we want to sacrifice it. So in next image, we have said goodbye to that also, right? So that means over here, carotid sheath gone, right? So now we see the complete structure, right? Let's have a lateral view, right? So from anterior side, everything is good. So that's the lateral view. But in order to see this thing very clearly, like pharynx, over here also will be sacrificing this entire thing. All the muscles, everything, right? Skeletal system plus muscles, everything whatsoever is behind, right? Behind the larynx, we really don't want, right? So we sacrificed it. And there comes the larynx, right? But where is larynx, right? That's okay, because this is what we really saw when we were watching that pharynx, right? Okay, this is trachea and this is esophagus. Esophagus, correct. Let's rotate it. So this is a lateral view and we go to the posterior view. This would be the view which will give us everything what we really need to understand. So that's the posterior view, right? The real fun is about to start now. So what exactly it is showing? First thing, this is pharynx lower part, right? Yesterday we talked about it, that this is the pharynx, right? This is the pharynx, the lower part. Perfect, right? And the pharynx was having nasopharynx, it was having oropharynx, and then it was having laryngopharynx, and then it was opening into the esophagus, right? So here it is, see, very proper, right? That's the esophagus, and Because this is posterior view, so anteriorly there will be trachea, right? We saw that thing into our lateral view. But we are interested in this, right? Now, this, because this entire thing is pharynx. So what we do is, what if we remove the posterior wall of pharynx, right? Imagine, right? We just remove, this is the pharynx, right? This is anterior, posterior. We just remove the posterior wall. So then we'll be able to see the entire anterior wall of pharynx, and that's where the larynx would be lying, correct? That's where the larynx would be lying, because larynx is at the mouth of trachea. Now trachea is on the anterior side, so that's why we are removing posterior wall of pharynx, right? So posterior wall is what we are about to cut. Okay, and here it is. That's our larynx. See, first thing first, this one. Now change color, right? I take red color, and as I mark, see, this is a nice opening, right? And when we watch it like this, right, we'll be able to see the vocal cord and all the way going in, and we'll be able to see the trachea also. So what we did, we just removed the posterior part, right? Okay, so this opening, this is what is called as the superior laryngeal aperture, right? Superior laryngeal aperture. Now let's make it still better. And as I said, right, we just stand up and we tilt, right? So that's where we see the deep, that's the vocal cord, right? So this is more or less like a top view, right? This is more or less like a top view, right? Not exact top view, but quite an inclined view. We see so many structures over here, so we'll start defining them, right? First thing first, always start with the easiest thing, and this is nothing but back of the tongue, right? Back of the tongue. All right. So then there would be this gatekeeper, right? This gatekeeper who is handling that food should be going into the esophagus and air should be going into the trachea, and that is epiglottis. This is epiglottic cartilage. Later on, we'll talk about hyaline cartilage, elastic cartilage, etc. Right now, for the till we understand the whole architecture, we'll not be going into all those histological details or all of the things. Right? We'll just understand first the whole architecture. Then we'll add all extra details. Then we remember thyroid cartilage. We remember cricoid cartilage. There would be third one, right, which will be coming over here, right? It will be coming over here, because right now, see, there is mucous membrane, right? We have not yet removed the mucous membrane. The moment we'll remove, we'll start watching all these structures, right? But so over here, be familiar, it would be like arytenoid cartilage, right? It would be arytenoid cartilage. On tip of arytenoid, there is corniculate, then cuneiform, then tritition. All those minor things will come later, right? Okay. One point, this fold, see this fold, right? That fold is epiglottic, because it is starting from arytenoid and going towards the epiglottic, right? So that's why we'll call it epiglottic fold. Fold is nothing but mucosal thickening, right? So that is epiglottic fold. And here is very nicely a fossa, a recess, a space is seen, and this is what is called as the pyriform recess. Pyriform recess. See all these structures, right now we are learning these structures. Then there'll be one special session only for the radiology. That is where, right, in barium swallow, barium meal, whatever we are understanding, right? So in barium swallow you'll be able to identify every structure so amazingly, right? You'll be very happy with yourself. But just be familiar with where exactly these things are. Okay, so this is good, right? Quite easy. Now we add, see, this is that epiglottis, right? It is quite flexible, right? This is epiglottic cartilage. When you lower it, right, there is a space. This is tongue. This is tongue. So the space between tongue and the epiglottis, you'll find this is what is called as the vallecula, right? Vallecula. So that was vallecula, and this is pyriform recess or the fossa. Okay. Now we want to see the structures of larynx, right? So what we have done in this case is we have divided it into midline, right? That sagittal section. So that sagittal section has been taken. So this is anterior and this side is posterior. Why so? Well, we can see that all the cartilages, they are on the anterior side, right? And one important thing, which cartilage are we talking about? Well, this is thyroid cartilage. Fair enough, right? Thyroid cartilage. Yesterday we learned that it is this cricoid, right? Cricoid is like this. That is on the anterior aspect, it is smaller one, but the posterior part, right, it is big one, right? It is bigger. So over here, well, that's the cricoid, right? That's the cricoid cartilage here and here. So that's why this is posterior, right? So that is the cricoid cartilage. And both of them, they are making the framework. Fine. We saw one more thing, and that is the epiglottic cartilage, right? So that was epiglottic, that is over here, highly flexible. Fine. This epiglottic cartilage, right, as it is going down, right, as it is going down, right, see here, there would be arytenoid cartilage. So this particular fold, right, this particular fold, that is epiglottic fold. So right now you just trust me that this is epiglottic fold, because we have not yet done darshan of arytenoid cartilage, right? We have just seen cricoid and thyroid. So this is like a guesswork that this is a fold, right? Okay. Let's add. Now we go to this. See, the mechanism is, so here is thyroid, right? Underneath is cricoid. Cricoid is giving a platform. Thyroid and cricoid, they both are having that joint, right? Now on the head of the cricoid, arytenoids will be sitting. On the head of arytenoid, corniculate will be sitting. On the head of corniculate, those small cuneiform, they are like hook, they will be sitting, right? Now because there are multiple joints, so when the muscles, they will pull, right, it is like it would be tilt, it will be tilt of the that cricoid cartilage. That cricoid cartilage will move, but because on the head of cricoid, those arytenoids, they are sitting, and those arytenoids, they will be connected with the vocal folds, right? So that's what we are watching over here. Sure, sure. So see this one and two. This is vocal fold, right? This is vocal fold. So whenever we say fold, fold means what? Fold means thickened mucous membrane, right? So these are thickened mucous membrane. We have not yet removed mucous membrane. It is still over there, right? Similarly, over here, it is the vestibular fold. That means, say, why these folds should occur. That means there is something inside, right? Something inside. And yes, you are right. Over here, as we'll proceed with our dissection, we'll see that there is a vocal ligament, right? Vocal ligament. But because this vocal ligament is covered in mucous membrane, that's why it is giving that vocal fold. And in between this space, right? In between, this is what is called as the vestibule, right? Vestibule. Right now, in this, you should be able to identify that yes, this is the cricoid, right? That's the cricoid. And if we draw it like this, that's how the cricoid is, right? This is anterior, this is posterior, right? So that's how it really forms. It forms that entire complete ring. Okay. Now to make things interesting, here it is. This is endoscopic view, right? Now in endoscopic view, you have to think it like this, that this is anterior, right? This is posterior. Right now we are not talking about left and right. We'll come to that also. So how the endoscopy is done? Well, patient's head would be like this and you will be watching straight away, right, into the mouth, right? So when you are doing this, right, so here, that's what you really see. This is epiglottis, right? This is epiglottis. Then that one is vestibular fold, right? Then inside one, this one, right? That would be the vocal fold. So there will be folds, and then this is the entire space. This is which is going into the trachea, right? Similarly, over here, this would be airy epiglottic fold. So we just think it like when we took the section, right? When we took the section, we saw all these things laterally. So on one side there was epiglottis, and then there was a epiglottic fold because it was going from arytenoid cartilage to epiglottis, right? If this is the epiglottis, this is the epiglottis, that means over here somewhere there would be arytenoid cartilage, and that's why this particular fold is over there. Precisely, it is like that, right? And those arytenoids, they are like those pigeons, right? They are, it would actually look like that, pigeon, right? And they will be sitting on that cricoid, right? And then cricoid is connected with, partly covered with thyroid cartilage, and that's how the whole structure is there, right? That's what we saw in the form of the framework, right? So I'll just write arytenoid. A is arytenoid, E is epiglottis. Now see, right? That's how it really looks like. So clean, right? The vestibular fold, the vocal fold, right? So that's the vestibular fold and the vocal folds. Yes, don't worry. It means you will, I'll actually show you where exactly the arytenoid is. But just say wait for just 2 minutes, right? It is about to come. Otherwise I could have drawn it, but as it is coming, so that's why. What is the condition of patient? Conscious or what? Yeah, conscious. Conscious. Definitely conscious. Okay. Now we remove the mucous membrane, because see, everything is covered with mucous membrane, right? All this. So we remove the mucous membrane, and the moment we'll remove the mucous membrane, that's where things would start up. See, the mucous membrane is removed. How much we really now know? The clean cut thing, which is seen very precisely, is like, see, right? You know these structures, right? You know this structure, and see, that's what we said, right? All the cartilages, all the area epiglottic fold, but let's remove still further. Let's remove still further, and what we really see, this. This is what this is, thyroid, correct? Thyroid cartilage, and this is what cricoid, right? Cricoid cartilage. This is the point where they articulate. So it means if you pull the cartilage, you pull this cricoid cartilage, right? This would be the point from where it will move. So this is the articulation. This is the point where it would articulate, right? Greater horn, right? Less, that is, this one is lesser horn. That's what is getting involved into that articulation, that joint, right? That is over there. And this is thyroid, thyroid cartilage. It's shield, it's lamina, right? And in between, this is cricoid, this is thyroid. So this one, that is cricothyroid membrane, right? But the membrane is entire one. So this is like cricothyroid, if you really want to say. So you'll say ligament, and in between, because this is like median cricothyroid ligament, right? And similarly, there would be the posterior thickening, so that will come in the posterior part. This is that arch, right? Arch of lamina, or arch of lamina. That is for the cricoid. Now this is a big space, right? This is a big space. On that space, right? Do you see there is something shiny? That is the articulating surface. That means someone will be articulating over there. So here it is, right? Lateral view, and let's add our first component. The first component, this is the epiglottic cartilage, right? This is epiglottic cartilage. This is like a leaf, right? This is a leaf-shaped cartilage, leaf-shaped cartilage. And it is attached with thyroid cartilage over here on the back side, right? This is a posterior view, right? So this is a posterior view. So it is attached medial, right? And on the posterior aspect. Now, from there, let's see this. Now we'll start correlating it. So this is hyoid bone, right? That is the hyoid bone. Again, this is a sagittal section, right? and that's anterior. This one is posterior. And from the shape, right, because this entire thing is covered by mucous membrane, right, this is epiglottis, and we said that this is highly flexible, right? This is highly flexible. So from hyoid bone, these are all pads of fat, right? So here it is, epiglottic, right? That's thyroid, that's cricoid, and the cricoid on top of it, here it is, right? As I told you, they look like pigeons, right? So this is like the zoom thing. Actually, this one is cricoid, correct? Cricoid, that's arytenoid. Arytenoid cartilage. Now these arytenoid cartilage, say this is a posterior view, right? This is a posterior view. We have isolated that arytenoid. There are two reasons of it. Because this arytenoid is something which will be acting as one of the very important component for the opening and closing of those vocal cords. And very fine tuning will also be done by structures associated with it. So this is arytenoid isolated. Right? This is isolated. This structure, right, which is projecting up, this is what is called as the colliculus. Colliculus, right? Simply this is something which will be sitting on the cricoid, right? This is the cricoid on which it is sitting, and this is projecting up, that is colliculus, sort of like the body, right? Now in this is anterior, right? This one is posterior. The top is projecting back. This is projecting back, right? Similarly, there are two parts of it, one part over here and other part which is over here. Immediately you will notice that this part, it looks like articulating surface, right? So this is the articular surface. Articular surface. This means this arytenoid, it is not just sitting, but it is forming a very important joint, articular surface with cricoid, right? So that's the joint, cricoid cartilage. So that's the joint. If it is joint, that means it would be moving very effectively, right? What about this anterior part? Well, this anterior part, this is also called as the vocal process, right? So that means this particular cartilage has got two processes. One is the vocal process. We'll come to the second one. And from here, simply vocal ligament will be connected. Vocal ligament. And yes, do remember ligament means thickened mucous folds, right? But over here, the structures will be there, very tough structure. And so that's why this is actually a sort of ligament. Okay. One more angle, right? This is like a lateral border, right? This is the lateral border. So anteriorly, there is that vocal process, and posteriorly, so anteriorly, it is called as the vocal process where the vocal ligament would be connected, and the posteriorly, it is called as the muscular process. And that's where some of the major muscles would be connected, which will be taking part into this. Lovebird sitting on posterior. Okay. Yeah. And that's what I said, no? Like pigeons. Okay. So here it is, right? This, as I said, that this one would be projecting back, and this, the portion which is projecting back, that is called as the corniculate cartilage. ठीक? Right? Corniculate cartilage. Just remember, it faces backwards. So because here we have isolated this entire this arytenoid cartilage, now we'll put it back. So here it is. This is intact larynx, right? We have not yet disturbed it. So arytenoids, they will be sitting over here, right? Over here, just underneath. Same thing. If we really want to draw over here, to where exactly will they be? They will be something over here, somewhere over here, right? That's how arytenoids will be. Why so? Why they are here? Well, because in its anterior portion, right? This is the anterior. We know the reason. This one is cricoid, small portion. This is bigger one, right? The bigger portion. And over here, that's the vocal fold, right? So vocal fold is actually between that arytenoid cartilage and it will go exactly in the middle of that thyroid, right? Thyroid cartilage. So thyroid is in front. So that's why this would be the location of arytenoid, right? Arytenoid. Now this is what will give you super clarity. This is thyroid. Obviously, this is a superb top view. This is a top view. So thyroids, bus, that's it. They will be, that shield would be lying just up to this point, right? Done. Then the greater cornu, right? This one, that is the greater horn or the greater cornu. And just underneath, that's the cricoid, and which is forming a complete ring, right? So we can really see that's the cricoid. And on that, these are sitting, they are over here, that is arytenoid, right? That's the arytenoid. And on the tips of the arytenoid, that is over here, these one, right? One, someone which is facing back, right? That is all corniculate. Cone like, right? So they are like cone. So they are corniculate. Okay. Now, these arytenoids, right? These arytenoids, because it is forming a joint at the base. So think of how it can move. It can move medially, it can move laterally, right? This is vocal process, right? This one is vocal process. And from this vocal process, those vocal ligaments, they will be going over there like this, and thus this is how that rima glottidis will be formed. But right now, let's remove this. So that's the vocal process, right? And it is forming a joint, right? So it can move, it can rotate, right? So it can rotate, and at the same time it can move medial and lateral, right? So it can move like this and it can move like this. So these are the possible movements of arytenoid, right? So that's what, when these arytenoids, they go like this out, so that would be the abduction of vocal process, right? So these are the vocal process, right? VP, right? VP, vocal process. So when they go out, that is abduction of vocal process. When they come in, that would be the adduction of vocal process. right? So this would be abduction and this would be adduction. Yes, yes, that was peritoneal fold. Not at every place, because in head and neck, so there are real ligaments are also, right? We have seen that so many real ligaments are there. Okay, over here, now see the real most fine things. We here orient yourself first. We have removed just one component, right? What we have done is, say, the entire thyroid cartilage was there. We have just removed right-sided thyroid, right? We have removed right lamina of thyroid. That is what we have removed, thyroid cartilage. That's what has been removed. Otherwise, we have kept rest of the things intact. Right? Oriented. See, this is left side, right? This is left side. Left side thyroid. This is good, intact. Right side, which was over here, right? That is what we removed. This is what cricoid cartilage, right? This is cricoid, and then this is what on head of it is sitting. This is arytenoids, right? Arytenoids, and on head of arytenoid, that is the corniculate. Okay, so and this would be the place, where the joint would be there, right? Joint between cricoid and the thyroid. So that portion has been removed. This is the reason why it was removed. As we know, this is what arytenoids. In arytenoid, we understood that in the front portion, that is in the anterior part, that is what? That is vocal process, correct? Vocal process. From vocal process, there are ligaments, right? Those ligaments will be going all the way where? That's the thyroid cartilage, correct? That's the thyroid cartilage. On the posterior wall, right, in the middle, they are landing, correct? So that's where these are the vocal ligaments. So it is necessary at this point of time that now the orientation should be very proper, that where exactly is arytenoids and this vocal process, which is in front of, which is on the anterior aspect of this arytenoid cartilage, and from there those ligaments they go, right? What are these ligaments? We are coming to that, right? And those ligaments will go and they will be landing on the posterior wall of thyroid cartilage, right in the middle, right? So now it's forming a shape. This vocal process, we would add one characteristic, and that characteristic is that this is highly mobile. It is flexible, highly flexible. Now this is once again generating a lot of interest, because then it is very good, right? See, arytenoids, this anterior process, they are flexible. So when we really want to change the voice, you want to change your pitch, everything, all these things will be coming into picture. Now, opposite side, this is acting like an anchor, right? So this portion is fixed. Got it? So that opposite portion is fixed. In exercise, about battle ropes, right? In battle ropes, that they just do, right? Sorry, right? So that's how the exercise is done. So that anchor is fixed. So this is acting as an anchor. And then the mobility is on our side. So that's how they'll be working. So what if this cricoid cartilage, right? If this cricoid cartilage tilts forward, right? The cricoid cartilage tilts forward. If cricoid cartilage tilts forward, so obviously it will take the whole assembly forward, right? So arytenoids will also be forwarded. When arytenoids are forwarded, so those vocal processes will also go near. and that's like this, correct? So here the cricoid tilts. So this is the tilt of cricoid cartilage, and that leads to change in the tension of vocal ligament, right? So tension of vocal ligament changes. So when it will be tilting backward, again they will be tight, right? So that's how these vocal ligaments, they are becoming slack or they are becoming tight, right? Same thing, right? Because when we are pulling it back, right? So they'll be tightened. But you remember we said that for arytenoids there are two types of movement. One movement that was okay because the cricoid was getting involved, right? So it was going forward and backward, right? That was okay. Arytenoids, they can move also, right? They can rotate on their axis. So remember, here is arytenoid. Over here and here, those vocal ligaments are connected. And now when arytenoids, they move like this, when they go like this out, right? They out. So that means they will be increasing the gap between these vocal ligaments, correct? So it is gap between those vocal ligament is affected by what? It is affected by medial or lateral rotation, correct, of arytenoids. Right. So that's how it will affect. Okay. Now see, this is how things look like. That vocal ligament since long, right? We are just drawing it like just like this a string. No, it is not. It is not an independent structure, right? It is not an independent structure. As such, there is a membrane, but one portion, because it is thickened, so we said that okay, this is a ligament. Otherwise, this vocal ligament is nothing, but there is one important structure. Now, first we'll see that structure is attached. How? Say this is what? Thyroid cartilage. This is what? That's cricoid cartilage. And over here, that is cricothyroid, right? Thickened portion. So we said that cricothyroid ligament. Okay. So this is cricothyroid ligament. Fine. But now the structure, it is attached over here. What is this? This is the posterior border, right? And the lateral one of thyroid cartilage, right? And then what about this? This is cricoid. So all the way over here, right? That is, it goes back. And then on top of this, there is arytenoid cartilage. So this is connected to that also, right? So over here, that's the cricoid. So that's the cricoid, arytenoid, thyroid, and that's how it really forms over here this structure, right? This one, sorry, this one, this is what I'm talking about. That is what is called as the conus elasticus. This is conus elasticus. So this conus elasticus is a membrane which is connected to the cricoid almost to its entire length, the posterior part of this thyroid and the arytenoids, and vocal cord is nothing but it is at the upper free border of this conus elasticus. So it means conus elasticus, that is a layer right? And the top is thickened, and that is what we are calling as vocal ligament. So over here, right, over here, what we are watching, it is at free upper border, upper border of conus elasticus. That's what is vocal folds or vocal ligaments, right? That's right. This is just for practice. Okay. Now this is a posterior view. Just for the reference, right? You should be able to identify the structures. This is now the image which we saw previously, right? All clear, right? That's the anterior, that's the posterior. And if we really want to say figure out that where exactly that conus elasticus is, so well, that conus elasticus, we'll just figure out that where is thyroid, right? That's the thyroid. All right, so let's start the elasticus from here. Then it goes down, and then there is cricoid, right? So it will go all the way like this, right? And then it will be, they'll be connected to that arytenoid. So yes, we were telling that arytenoids, they will be over here. So that's how it is the location of conus elasticus, right? That would be conus elasticus. See, everything is revolving around these cartilages only, right? Everything is revolving around them. And this conus elasticus, tough structure just underneath the mucous membrane, right? So this opening, in simple words, vocal opening, right? This is vocal opening, but there is a name which is given to this. No doubt, for our understanding, we'll keep on telling vocal opening only. Otherwise, it is called as the rima glottidis. Right? Rima glottidis. Now, this rima glottidis, this is the name for that vocal opening, but this is highly variable. This opening, right? It is highly variable. It changes in its shape, right? It changes in its size, right? All depends upon arytenoid cartilage, right? Cricoid will be supporting as a base, but it is the real shape changers. They are the arytenoids, right? So those arytenoid cartilages, they will be playing the extremely important major roles for change of the shape. Let's see some of the shapes, that how exactly it looks like. Say this will be like a diamond shaped, right? It will be like a diamond shape, right? Like this. This is when there is quiet breathing, right? During quiet breathing. When you breathe deep, right? So in deep breathe, its shape would be triangular. Its shape would be triangular. Now, when you try to say speak, right? When you try to speak or you try to sing, so at that point, you are controlling the air, because when the air is passing through a narrow opening, then it generates the sound, right? So this is what is needed. The in heart we learned that when there is narrowing of the space, then when the fluid is trickling, it will make sound. Otherwise, when the fluid is passing normally, there is no sound, right? But when this space is narrowed and then the air is pushing, so then it generates various types of sound. So it is the game of just change in the shape of these vocal cords with the help of all those muscles and the fine tuning by one more muscle which will come vocalis, right? We'll see that. So that is what generating the sound. So it means the supreme control is in the brain. So brain is sending the message to all the muscles, come on, you contract, you relax, contract, relax, and that's how the sound is getting produced, right? Imagine how interesting the whole process is, and especially when suddenly from one language you change more gears and you move on to another language, right? You change the language, but then message which is coming from the brain for the contraction of various muscles, right, it remains the same. It is the brain who is deciding that okay, which switch to operate for contraction and relaxation of, so that change in the vocal shape of the vocal cord it appears, right? So on speaking, when you speak, right, or when you sing, it is slit like, right? It narrows down, it narrows to a small slit, right, through which the air is passing. Okay, this is right when you hold your breath. So at that point, it is absolute shut off, right? So it closes. When you hold the breath, when you hold the breath, or when you swallow something, right? At that point also, it would just close. So that's why at times it is said that don't speak while eating, right? It makes sense, right? Our grandfathers, they used to say, at times they used to keep that mon, that while eating, they won't speak. See how interesting it is, because while eating, if this remains closed, that means there is no problem, no trouble, right? Food won't be entering into the trachea. But when you are eating, right, and then you try to speak, and even if a small portion goes into the trachea, and then that creates so much of discomfort, right? This is the reason why it is, because see, this is the area, this is a junction, right, where it is very easy that if this is open, food might slip in. Any role of vocal process, vocal opening? Yeah, definitely, definitely. See, no problem. I'll repeat that. See, we talked about cricoid. On the head of cricoid, those arytenoids are there, right? Arytenoids. Now say this is arytenoid, right? The anterior portion of arytenoid is called as vocal process. So now in the bird's view, right, that vocal process, right, that would be over here. Then from there, that's the connectivity of the vocal ligament, right? So this vocal process, this is highly mobile. So because it moves, that's why it would be changing in the shape and the dimension and the tension on vocal ligaments. So yes, vocal process is vital, right, for the vocal opening or closing, because it is flexible. But well, the actual full opening, that how see, there are so many things. It's like that vocal opening, it could be like this also, only the posterior portion widens, or it could be like this also, the whole of them widens, right? This is just to create all various types of sound. We'll see this thing, all these shapes, that how it actually matters. This is where when the muscles would come, and we'll say that, say only the cricoid, right? When the cricoid is pulled, right, when the cricoid is pulled, so it will tilt the whole structure back. When the structure is pulled back, so those arytenoids, they would be falling back. When they will be falling back, those vocal process, they will be pulled backwards, right? So that way we'll just see everything step by step, in the form of that how are the various shapes of those vocal openings they occur. Yes, vocal process will be playing a role in that, definitely. So that's where we are now adding the muscles of larynx. Now, normally this is considered as very complicated because small muscles where exactly everyone is going will do some cheating. It is what everyone is connected to everyone. That's how they work. So there is thyroid cartilage, there is cricoid cartilage, there is arytenoid cartilage. ठीक? So thyroid and cricoid connected. Cricoid, arytenoid connected. Thyroid, arytenoid connected. So there'll be muscles like this. Then this is arytenoid on one side. This is arytenoid on other side. So there'll be muscle between both of them. So that is also there. Nothing. These are the easiest way to remember the muscle, name of the muscles, right? Right now there are no muscles. We have removed all these muscles in this specimen and then now we'll start adding. But which muscle we are looking for? One is between these two big bosses, right? Cricothyroid. So there'll be cricothyroid muscle, right? Okay, so this is down, right? Then between cricoid and arytenoid, all right, so we'll call it cricoarytenoid, right? See, the names are very easy, right? Names are very easy, very logical name. Then between thyroid and arytenoid, so we call this thyroarytenoid, right? No confusion. Sorry, arytenoid, huh? Right? No confusion, right? Three muscles down. Then what name should we give to this muscle? Transversely situated between two arytenoids. So just transverse arytenoid, right? Transverse arytenoid. And then over there, epiglottic cartilage was feeling so bad, right? So then there goes one muscle which will go all the way from arytenoid and will go on the opposite side. Will go on the opposite side, right? They will be going like this. So these are called as the airy because started from arytenoid epiglottic muscle, right? So that's why we have written it in a different color. So now let's see all these, and once you see, you will find that this is so easy, right? Now at least you will be remembering the names, right? Between cricoid thyroid, cricothyroid, cricoarytenoid, thyroarytenoid, and the transverse arytenoid. These are the muscles. Now that's okay. There are one or two parts. In some cases, there is posterior part, lateral part. That's okay, but very logical, right? Okay. Let's add first muscle. First muscle, cricothyroid. So here it is, cricothyroid. And to make things a bit easier, let me increase the width. Now this will be fine. So cricothyroid. Now this cricothyroid has got two parts. Think like this. This is thyroid, right? This is thyroid. This is cricoid. This cricoid, it has got big surface over here, right? This is the posterior part. But there is a joint, right? There is a joint. That is the cricothyroid joint, and which is formed by that lesser cornu. So now we are adding the muscle over here. Watch for this. This is one muscle we connect over here, right? So where it is connecting at this point. Here it is. It is connected on cricoid, right? It is connected on cricoid. So this is the part which is going back, and then there is one more which is going like this. So we have got both between cricoid and thyroid. So we'll call that cricothyroid, but this part is called as the oblique part, right? Oblique part. And this one, which is going straight, it is called as the straight part. So straight part and the oblique part of cricothyroid muscle. Over here, that's where, right, it is connected onto the thyroid, the inner aspect, right? It is connected on the inner aspect. Now what will it do? This cricothyroid, see, when it contracts, right? When it contracts, when this contracts, right? When this contracts, what it does is it pulls the arch of cricoid upwards, right? See, even over here, you can see that. So this is the muscle, this is a bigger one, so it is a base. When it contracts, it will, this is the cricoid, right? That's the cricoid. So when it contracts, it will be pulled up, right? So it pulls this arch of cricoid up, right? So when the arch of cricoid is pulled up from the anterior side, this is cricoid, right? What would happen? So this means when this is pulled up, this thing would fall back, right? The cricoid would fall back, right? We are dealing with right now cricothyroid. So when it is falling back, right? Right? When it falls back, so this means this whole assembly would fall back, right? So when the whole assembly is falling back, that means those arytenoids, they will also fall back. When those arytenoids will fall back, it will lead to, so it is like arytenoids, cricoid, right? The posterior portion, they would fall back. And when they would fall back, this is what would be done, right? The vocal cords, right? Those vocal folds or the vocal ligaments, right? They will be like tightened up because this thing will go back, right? So that is, they will become longer, right? And tighter. See how interesting the thing is, because that there was the muscle. So it was knowing that this cricoid, on the head of cricoid, arytenoid is there, on and the anterior aspect there is vocal process, and from vocal process those vocal folds are going. So just take the base of the cricoid up, so that means the entire thing would be tilting backwards, right? So this is the first thing about how they, our first muscle, it works, right? Now to see rest of the muscles. So this is our, right, cricothyroid. We need to sacrifice this. Not only that, we need to remove half of the thyroid cartilage so that we can see rest of the muscles, because now they are all intrinsic, they are all inside, right? So we remove half of the thyroid cartilage. We remove this, and in fact we have to remove this cricothyroid muscle also, right? So we'll remove even that. Now see, immediately it is giving us access to rest of the muscle, right? These are all internal laryngeal muscles. They all operate inside, right? So these are all internal laryngeal muscles. Now one method is straight away we start pointing out which muscle is this. No, let's go it reverse way. Let's take out all the muscles and start adding one by one the muscles, right? So that way we'll be understanding that how the vocal cords, they are also working. So that's how we'll see for every muscle. So let's say all out, right? All muscles out, removed, no muscles, right? So orient yourself very properly. Easy things first. This is thyroid cartilage, right? That's thyroid cartilage. This one is cricoid, right? On head of cricoid, that is arytenoid, right? All this graceful curve, right? That is arytenoid. Good. And on the top, that pointing backwards is corniculate, right? That is corniculate. Okay. And the anterior portion, right? The anterior portion. So that is all vocal cord, right? So this one would be the vocal ligament, vocal ligament. And we said that vocal ligament is not an isolated structure. Vocal ligament is the thickened upper free border of conus elasticus, right? So now we are completely comfortable with these structures, right? I'll just remove this also so that you can see it properly, right? All done. Now add muscles, right? Still, say if there is, say we removed some more mucous membrane. So now these arytenoids, so they are seen so beautifully, right? They are absolutely fine. Okay. Practice. Now to this, we add the muscle between cricoid and arytenoid. That's the muscle. But it is over here, so then it is over here also, right? It is over there also. So this is now we are dealing with cricoarytenoid. Cricoarytenoid muscle. You remember we said that for the arytenoid, the anterior portion is called as vocal process and the posterior portion is called as the muscular process. Here it is, the muscular process, right? This is the muscular process. Muscular process of arytenoid. It's not so that it is going to gym every day, but it is muscular because muscles will be connected over there, right? Actually, the one muscle which is connected over there, right? This is a deeper muscle and this is cricoarytenoid. Now, as we said that it has got two parts. This one is the posterior part, right? Posterior part. And this one, that is the lateral part, right? This is a lateral part. But both these parts, posterior part and lateral part, they all would be converging towards the muscular process. Now think, this is arytenoid, right? This is arytenoid, and let's say this portion is the muscular portion. ठीक? Anterior side, so now you know that those vocal ligaments they are there, right? Vocal process, and vocal process is mobile, so it moves also. Fine. This process, right, where the muscles are there, so when they contract, right, and not only that, if this muscle, it can even rotate, right? It can even rotate, right? Because it is right on the that muscular process of arytenoid. Now the base is cricoid, right? Now the base is cricoid. So think it like this, that this cricoid, right, which has got that huge lamina, right, the back. So that back of lamina is giving rise to this cricoarytenoid. Now, when it is giving rise to that cricoarytenoid, it means it has got a strong base, right? That is on the cricoid, and it is diverting for that small area, right? Small piece on arytenoid, right? Similarly, the upper border, right? See the upper border. That's the upper border of cricoid, and that muscle is also going towards the muscular process of arytenoid. And then there is an articular surface. So it means now there will be the movement, how these muscles work. And because these are in pair, so opposite side is also there. So they can contract bilaterally, unilaterally. So that will lead to all sorts of, say, movements. Okay. So this is fine, right? Remember that posterior part and lateral part of cricoarytenoid converge. This is very important. Converge at muscular process, right? Muscular process of arytenoid, right? It is there. Yeah, already written. So let's see these what these muscles do one by one, right? First, we are dealing with the posterior cricoarytenoid. That means we are dealing with this muscle. When this muscle contracts, right, it pulls arytenoid back, you know, because when we say muscle is contracting means this is the muscle all the way connected and this is the muscular process. When it contracts, it will be shortened, right? When it will be shortened, that means this muscular process will be pulled back. It will be pulled back, right? But then for arytenoid, right? For arytenoid, right, there is a joint. So, and this is on one side. So from one side, when you are trying to pull, in fact, it goes back and it rotates also, right? That's the interesting thing. That posterior cricoarytenoid, it pulls back, right? It pulls muscular process back, so which results into backward and the rotational movement. So it rotates arytenoids. It rotates arytenoid cartilage, right? So obviously from side, so it is rotating like this, right? When it rotates like this, that's what really happens, right? Interesting. This will lead to widening of vocal openings, right? Because that arytenoid, it would it would go like this, it would go like this. So that's what leads to widening of vocal gap or the vocal openings, right? So this is what is really happening to arytenoid. Only the posterior fibers, right? Now we are watching what would happen when the lateral would come into picture. Now, right now we are understanding that, okay, all these muscles, they are acting in isolation. In real life, right, they will be, all of them, they'll be working simultaneously. So that's where the real fun comes. Okay, so here it is, the lateral, again, between cricoid and arytenoid, right? So lateral cricoarytenoid. Where is it? Here it is. That's the muscle we are talking about. So when that contracts, right, again we said that it is the muscular process who will be affected. So here it pulls forward, right? It pulls forward, and this is laterally situated, right? So it pulls forward and laterally, right? This is about lateral cricoarytenoid. So cricoid is fixed and it pulls it. Pulls whom it is pulling? The muscular process, right? And see, in this case, it is pulling, right? So that rotation, see, just a minute, yeah, right? They are pulled laterally, right? When they are pulled laterally, there is maximal widening at the back of the opening, right? Because those arytenoids, now they are pulled laterally. Previously, they were just moving like this, right? They were moving like this. That means there was symmetrical opening. So the difference would be something like this. That is when the posterior, right? That's how the posterior Cricoid was operating, right? This is how the vocal folds or the vocal gap was getting generated. But now it is this, it is affecting the posterior part, right? So there will be maximal widening of posterior part of, right, vocal gaps. So that was the posterior, and that's how the lateral would operate, right? So that's the case of lateral cricoarytenoid, right? That was for posterior. Okay. Sorry. Now see, thyroarytenoid and transverse arytenoid. Now we are about to watch these two muscles. Those two, they were you doing what? They were increasing the gap, right? They were increasing the vocal opening. So there has to be someone who will be narrowing that opening. Well, that is thyroarytenoid. Thyroarytenoid, right? And transverse arytenoid, but transverse arytenoid, it's so easy. So you will understand within 5 seconds. Let's see thyroarytenoid, right? That is worth watching. What both of them they will be doing? They'll be doing just the ulta of what cricoarytenoid was doing, right? So this is like they will shorten and they will narrow down the vocal opening. Vocal opening, right? So let's see that. Where is it? Simply speaking, this is what this is. This one, arytenoid, right? Front of arytenoid, and that's our big boss, right? Thyroid. Simply no big complications. This is thyroarytenoid muscle. Just simple as that. From the inner aspect of thyroid cartilage, all the way it goes the front of arytenoid, right? So inner aspect of thyroid to front of arytenoid, simple, plain as that, right? And that's the muscle, right? That's the muscle. Now when this contracts, right? So easy, pretty easy, because it will simply, this thyroid is so big, so he's not gonna move, right? He'll say, come on arytenoid, come near, and it will pull, right? Obviously this is going to squeeze, right? Let's see another view. This is the posterior view, right? Posterior view. We are adding transverse arytenoid. This one, no introduction needed, because what transverse arytenoid would do? This is transverse arytenoid. Let's see. See, this is like those, right? Those lovebirds, right? So like this, right? And here, the little aspect, here, the lateral aspect, and that's the transverse arytenoid. Bus. So when they contract, obviously they both would come near, right? So that cricoarytenoid was widening it, and transverse arytenoid will narrow it. And this thyroarytenoid will take it close to the thyroid, right? Thyroid cartilage. So that's how it forms. And by the way, these muscles, this is like we have already seen it. It is none other than this posterior cricoarytenoids, correct? Arytenoids. Okay. Now let's see this. What they really do. Now thyroarytenoid, say when it contracts, right? So that arytenoid cartilage, it tilts inwards, right? Because there is a joint. So that's the arytenoids. There is a joint. There is crico, right? This is airy, and when such powerful thyroid pulls, right? So the head of the arytenoid, it goes like this, right, to forward. So here what it really happens is that this arytenoid cartilage, right, it tilts inwards and pulls forward, right? So it tilts inward plus this is a big muscle, so entire assembly is pulled forward, right? So it's like entire assembly, right? Entire assembly means the arytenoids, cricoid, everything is pulled forward, right? So entire assembly, so the crico plus airy, they are pulled forward. What would be the effect, right? Easy to guess, because now it would lead to this, right? The whole thing has gone forward because the base was thyroid, not movable. So here, those vocal ligaments, they become loose, right? They become slack, right? They become loose. So that's why it happens. It leads to shortening of vocal opening, right? Vocal openings, they become shorter. So shortening of vocal openings, right? Shortening in what way? Shortening when you are counting from front to back, right? This is important. When you count from front to back, obviously, because such powerful muscle, when it is pulling up, the whole assembly is going, and on top of it, because there is arytenoid and then here is the cricoid, it is on the top. This is a joint, the trunk, it goes in, right? And the whole assembly goes out. So obviously that distance is going to decrease. Acha. Yes, yes, yes. It is actually like, so when we speak a single word, then all these muscles work so hard to make voice. Absolutely. Right. And when you speak, sometimes, they say tongue twisters, right? That चंदू के चाचा ने चांदी की चम्मच से वगैरह वगैरह, right? Or कच्चा पापड़ पक्का पापड़, when you try to speak. Why they are called as tongue twisters? It is because to generate those sounds, I mean, so many muscles they have to work. I mean, it is like a very high speed computing, right? And it is not so that only these muscles they are contracting by their own. The message has to come from brain, right? So brain would say, okay, crico, you, okay, thyroid, you, right? So what brain must be telling that, okay, you will just contract this much, you contract more, you contract less, and then judging that is the sound coming proper, right? This is such an amazing thing. Means it at times it becomes difficult to even imagine that how fast it is happening. And when you change the language, right, so then brain has to flip that, okay, for generation of this sound, right, अब इसको ऐसे बोलना है. So immediately it will say, okay, for these, this is the list and these are the muscles which will be deployed, start sending the signals. And this will be still more interesting when we'll be adding nerves to that, right? Then when we'll say that these nerves, they are coming from where, how that area That's why I thought of that, yes, we'll be integrating brain along with it, because then it becomes a super computing process, that how the brain is thinking, from where that Broca's process, right, Broca's area, right, they'll start sending the signals. And then at the same time, what you are speaking, you will listen, you will analyze it. Am I speaking okay? And that's how it really goes, right? And on top of it, when the emotions are involved, when the limbic systems they come into picture, that's why it is said that, say, the world's biggest fear is, it's not death. World's biggest fear is stage fear, right? Why it happens that suddenly on stage we start forgetting everything, right? When we read so many things in detail, but when it comes to interview, saaf, right? Well, yes, it is true that we have to try tongue twisters daily for a few minutes. Actually, not only that, I'll tell you that for fitness, right, for your mental fitness, say there are few aerobic exercises, and in a way that when the hand is moving like this but the opposite leg is moving in different axis, so it is like your legs are moving like this but your hands are moving like this. When you try to do that, right, you have to think a lot, right? You have to actually train yourself for that. And when you do that, yes, it takes you one step higher. And that's the reason why these exercises they play such a big role. Say, very simple, when you are doing skipping, right, when you are doing skipping, yes, you can do it at a high speed, but then cross it, sorry, right, then cross it. And then when you cross it, so you'll find that not only it will give you immense pleasure, because immediately different group of muscles are involved, but at the same time brain has started functioning in a very different way, right? Want to make it still more interesting, now you go on one leg, right, continue skipping and you go on one leg. Now body has to balance also, right? So it means now that intricate balance with only that left foot or right foot, whatever you are using, right? So that thing, that makes things more and more interesting. Yesterday I was reading one very good health magazine, and they explained that kettlebell in a very interesting way. And yes, it was like that, why people start developing so much of back pain when they use that kettlebell. So so it's like how to use the kettlebell in its most correct form, right? Will definitely, I'm though I'm telling, but I'm somehow, say, running short of time. But that fitness video, or we can even go for live session, because to make a video, it takes so much of time. Straight away, I'll put a camera, I'll start working out, and I'll keep on telling you. I think even we can do that. Because if it is live, to then you can even ask also, and it can be done in that way. Anyway, so just mail me, right? We'll plan it out. Maybe it has to be done in the morning. Okay, coming back to this. So this is shortening of vocal openings front to back. Right? Okay, one more. Now this is transverse arytenoids, right? This is transverse arytenoids. So transverse arytenoids, simply when that muscle contracts, it will take both of them near, right? So it means two arytenoids come closer, right? Here it is, right? So closing of the posterior part of vocal opening, right? This is what is done. So they will come over here, over here. So this closing of posterior part of opening, posterior part of vocal opening. See, every muscle, it has got a specific function. So when you speak, yes, it is the combination of all these muscles. Just speaking one word, yes, all these things are happening. Right? For your practice. Now, the last muscle. You remember we said that epiglottic muscle, right? So over here, from the arytenoids, right? From the arytenoids, all the way it is going towards the epiglottis. So it is going in cross, right? So this is what is called as the epiglottic muscle. Now this is very, very interesting muscle. You must have marked that thyroarytenoid, right? The whole assembly which was taken forward. So thyroarytenoid. Then transverse arytenoid, right? They come near each other. Transverse arytenoid. Both of them, as such, if you see, they are just closing, right? They are closing the larynx, right? So they are deployed in closing the larynx. Add one more muscle, and it is this epiglottic. So epiglottic, it goes like this, right? Cross. So this is like a sphincter action, right? This is like a sphincter action. So these three muscles, one, 2, and 3. All three combined, they lead to closing the larynx. And that is what is needed when you swallow something, right? When you swallow something, when you drink something, when you hold your breath, holding breath. So during all these stages, when the larynx has to be absolutely shut down, so that's what they really do. Now, still more interesting thing. This epiglottic muscle, only the medial part, only the medial strings, few medial fibers, right? These few medial fibers, they are special. Those medial fibers, they are special. That medial part, right? That medial part of epiglottic, that is what is called as the vocalis. It is called as the vocalis. And it is this vocalis which is for very fine adjustments. When you speak, adjustments. So when you speak, they come into picture. Right? So that's how, say, they work. All right. Now we are just adding the final portion, and this is like infrahyoid muscles, right? Infrahyoid muscles. And we'll see thyroid, parathyroids, we'll see that also. So here it is, like say thyroid, right? That is cricoid, and that one is trachea. So let's add the structures one by one. So we have just added those carotid sheaths, right? As said, that we'll be putting everything back to its place. So this is carotid sheaths. They are replaced, which will be carrying all those major blood vessels. Yeah, here it is. See, this one and this one, right? They are parathyroid, right? These are parathyroid glands. Now there are 4, right? 2 superior, 2 inferior. So this one is superior parathyroid, right? Deeper ones, they are still deeper, right? Those inferior ones, right? They are deeper. That's putting back the thyroid gland, right? So that's the thyroid. And thyroid has got those lobes, right and left lobes, right? And that one is called as the isthmus. That is the joint between both of them. right? And these right and upper lobes, they go all the way up to the level of thyroid cartilage, and this is where it goes to the level of third ring of trachea, right? Third tracheal ring. Now to this we add one more muscle. This one is thyrohyoid, correct? Thyrohyoid. So that's where the hyoid is there, right? That's where the thyroid is there, and this is the thyrohyoid. And then from thyroid, it goes down, and this one is sternothyroid, correct? That is sternothyroid. So in fact, say from hyoid to thyroid and thyroid to sternum, this is actually one muscle only, right? It is like one muscle, right? It's like a one continuous muscle. Okay, so this is where the body of hyoid. Then for thyroid, right, it gets connected at, in case of thyroid cartilage, you remember oblique line? There was oblique line. Oblique line was between superior tubercle and the inferior tubercle, and that was the oblique line, right? It is this oblique line that is where it is connected, and from oblique line only the sternothyroid starts. So here thyrohyoid, it starts above, ends at oblique line, and from oblique line it continues all the way down, right? To the upper end of it, goes all the way to the upper end of sternum. So that's how this whole muscle, it acts as one. Finally, last pair. In fact, we have seen these muscles, right? This one, which is going laterally, so that is omohyoid, right? Omohyoid. And one which is over here, and that is sternohyoid, right? Sternohyoid. And if this is the body, so then how are they? Over here and over here, right? Say this has to be medially, so sternohyoid, and this one would be the omohyoid, right? So that's the body of the hyoid. Interiorly, that's how they are connected. Regarding the omohyoid, here it is. This is the omohyoid, right? It has got this belly, double belly, and it goes underneath the trapezius, right? It goes underneath the trapezius, and it inserts on the upper border of scapula, right? Upper border of scapula. And finally, we just add sternocleidomastoid, right? So we add sternocleidomastoid, and we add clavicle to put this thing back into shape, right? So this is the point from where we started. Now, those important things. We said about that there are few cartilages. So thyroid cartilage is good, cricoid cartilage is good, arytenoid cartilage we talked about. Then on top of it there is corniculate cartilage, right? That also we saw. Then there is on top of it. So if this one is that our lovebird, right? On top of it, if this is corniculate, then there is a small one that is what is called as the cuneiform cartilage. Cuneiform cartilage. All those cartilages, they are for fine adjustments, right? Very tiny cartilage, right? And this is the cartilage which is located in airy epiglottic fold. Makes sense, right? Airy epiglottic fold. So when it is going obliquely, right, this is the cartilage which is over there. And then this was the hyoid, correct? That was the hyoid. And below that there was thyroid, right? In between thyroid and hyoid, right, there was thyrohyoid membrane, correct? Thyrohyoid membrane. And on the lateral aspect, on this free edge, sometimes you will get this cartilage. Now this is variable. So this is trapezial cartilage. This is variable, sometimes present, sometimes not. It is said that about 30% they have got it bilaterally or unilaterally. So this is of very highly variable, right? And finally, we create this, that cartilage, right? We just do a sort of brain mapping. Two types. One is the hyaline cartilage, right? Speciality of hyaline, they are firm and strong, right? Hyaline cartilage, they are firm and strong. So that means they will be used for the framework. So that structure remains proper, right? And this is like type 2 collagen, right? Because they are hyaline, so this is type 2 collagen. And they are, obviously we said the framework, so thyroid, right? Done. Cricoid, sure, right? Arytenoid, definitely. But the moment we wrote arytenoid, right, one portion of the arytenoid started jumping. No, I am not part of hyaline. I am not that firm fixed. I am mobile, right? So let's write just mostly, right? Because one part of the arytenoid is telling that I am mobile. So that means the second group must be elastic. So their characteristics, flexibility, right? And whom would we like to add first? Immediately that vocal process of arytenoid said that me, right? Vocal process of arytenoid. So that is flexible. Otherwise rest, epiglottis, we said that, right? It is highly flexible. So that is epiglottis. All these chota cartilage, that is that corniculate, right? Cuneiform and trapezial, all they are elastic, right? Because they are flexible. So that's it. That's it for today, right? Saving this file. So thank you so much. I know it was a pretty heavy topic, but worth it, right? Thank you and see you soon again. Right? Take care. Bye bye and good night. Bye bye. Mm, yes, size of the larynx, it increases. That's right. So as the age increases, right, size of the larynx increases, and then there is formation of that Adam's apple, right? And it has got even effect of hormones. So yes, there is effect. All right, thank you.